Moving on, we'll discuss to the public and private healthcare services. So there are two types of healthcare services. Public healthcare services is a chain of health centers and hospitals which are run by the government. They are the connecting link between the rural and the urban areas, because the people who live in villages, for each and everything they cannot come to the urban areas. That is why government ensures that there are certain centers which provide good services in rural areas too. These services ensures the availability of health services in both the areas, and these centers are well equipped so that proper treatment, on time treatment could be given to the person who is suffering. Now, primary health care center. What are primary health care centers? The village level health care centers, they have a nurse and a village worker to provide any type of care. Like there is a nurse, that is a trained nurse, and then there is a person who is also a trained person but is from village only. This nurse and this village worker works under the guidance of a doctor, working at the primary health care centers, and PHC centers covers many villages in a rural areas. So on small levels we have dispensaries, but if I am talking about on a bigger term, then I will refer to PHCs. Then I will talk about district hospital, because a district is bigger than a village. So a district hospital means that supervises the health of like all the health centers are covered under the district hospital. And then in large cities like India, we have government hospitals. This type of health centers are called the public centers for many reasons. I told you there are public healthcare centers and then there are private healthcare centers. So why are they called as public healthcare centers is because whatever resources are required to run these centers is received from the public, because I told you that we are the one who are responsible to provide the financial supports. And also these public healthcare centers takes an action to prevent the spread of diseases such as tuberculosis or malaria or cholera or jaundice, which can turn into epidemic. If I give you an example of the present situation, all the primary healthcare centers, the public healthcare centers, all the government hospitals were providing the vaccines for the COVID free of cost, whereas all the private hospitals were charging an exorbitant amount for that. So that is the reason that they ensure that any disease which can break out into endemic, which is already a pandemic, or some such sort of diseases should be controlled well before in advance. We will again go back, as I told you that I will come again on this story of Hakim Sheikh, the same question that why did he file a case against the government. So what our constitution says, that primary duty of the government is to provide the good health services and to ensure the welfare of the people, and government should safeguard the right to health. Like we have right to education, we have right to vote, similarly we have right to health, right to life also, and it is the duty of the government to safeguard this right, because this is the fundamental right given to every citizen. Now why Hakim Sheikh filed a case was, earlier he was referred to government hospitals and none of the government hospitals had the proper facility and the trained people to entertain the case of Hakim Sheikh. Later, to save his own life, he was admitted to a private hospital, but why he should pay huge money, and that is the reason that he filed a case against the government. Connecting to the story of the Hakim Sheikh, now when this case was heard in the court, what did the judge said? That it is the duty of the government to provide necessary healthcare services, including the treatment in any emergency situation. Duty of hospitals and medical staff is to provide the treatment, which was not provided to Hakim Sheikh. Hakim Sheikh was denied the treatment at various government hospitals, and therefore the court asked the state government to give him the money to reimburse the money that he spent on his treatment. Now we will discuss that what are private health facilities, what are private healthcare centers. So all the healthcare centers which have doctors and facilities privately owned, they fall under the category of private healthcare centers. In rural areas, there are registered medical practitioners to which we call as RMPs. In urban areas, there are large number of doctors, private clinics, laboratories to get the test done, to get the blood or whatever services you need, and apart from that there are private medical shops also which sells the medicines at a very high rate without providing any rebate. Unlike public healthcare services, patients have to pay a lot of money, as we saw in the case of Hakim Sheikh, as we saw when we were discussing the case study of those two kids. They run hospitals and are engaged in manufacturing and selling of medicines also. Healthcare and equality. We will now discuss that is adequate healthcare available to everyone. In India, private healthcare facilities are increasing, but public healthcare services are not. What is the reason? As the cost of these private services is too much, not everybody can afford them. Private services sometimes encourages practices which is unethical. Barely 20% of the Indian population can afford medicines at the time of emergency. When I say unethical practices, then I want to refer that at times they will write some medicines, the doctor will prescribe some medicines which are available only at particular stores, and those particular stores have some sort of tie-ups with the doctor or with the private clinic, that as many orders we will get for this particular medicine, we will increase your margin, and to these practices we say that they are unethical. It's the responsibility of the government to provide good healthcare services to all the citizens, especially the poor and the disadvantaged. In 1996, this we will discuss. I am just going through, I am reading these 2-3 lines. We will discuss this case study again in detail. In 1996, Kerala decentralized its health budget at Panchayati level to ensure that effective health planning is being done. And the best example of healthcare comes from Costa Rica, where the government provides for adequate healthcare to the people. Also, in a democratic country like India, people always expect the government to work for their welfare even when they are paying for all these services. Now, health is a vital aspect because only the healthy people can prove themselves resourceful. If I am paining every day, if I am suffering from some or the other problem every day, will I be able to give my 100%? No. I will not work efficiently. On the other hand, if I am in a good health shape, physically also and mentally also, then I am a resource for the country in true sense. So, health means our ability to remain free of illness and injuries. In broader sense, health means something more than this. This I already told you that when I talk about health, you will always think that one should be physically fit, but health means more than that. Apart from diseases, we need to think about the other factors also, such as everybody should get clean drinking water, the environment should be free of pollution because in a polluted environment you cannot breathe properly, and all these things in longer run affects our health. Adequate food is also important because an undernourished person can never be a resource for a country. Third thing is not only the physical stress, but the mental stress also causes the person to become ineffective, and thus good health include both a sound mind and a sound body. When I have discussed what all is there when I talk about health, it is important to talk that what can be done. So, the health of most people do not get medical attention because this is a tendency in India that we never visit the doctor until and unless the problem is acute. When we start realizing now this is going beyond my capabilities to control it or to bear it, we will knock at the doctor's place, otherwise not. And especially when it comes to the public health services, they are really in a bad shape. According to the constitution, government is responsible for providing equality in terms of healthcare services to all the citizens. So, when it allows for the setup of any private hospital, it should ensure that in that area there is also one government center that is working for the health of the people, because otherwise if there are only private centers, then people by no choice have to go there. So the government should take care of the health of especially the poor and the backward people who cannot afford these costly private health services. Some of the famous approaches that the government has taken are Bhamasha Swasthya Bima Yojana, Aam Aadmi Bima Yojana and Employees State Insurance Scheme. I have just mentioned few, though the list is endless. But over here I would also want to say that these schemes are not properly implemented, because if we really want to take the advantages, you will see that there are lots of formalities which illiterate rural people find it difficult to do, and that is the reason when it is emergency they always run towards the private centers. Now I told you that we will be discussing the Kerala experience and the Costa Rica approach. So here it is. The government of Kerala allocated 40% of its total Kerala budget to the panchayats in 1996. Why did the government do that? To ensure that the villages could do proper planning for food, for water, for women's development and for education, because Kerala government thought that this is something really important which needs to be worked on, and I will not wait for any central government to give me the money for that. Instead, my state budget will be diverted towards this cause. These funds were also utilized to improve the condition of few healthcare centers, but this cannot be okay in just one run. These steps have to be taken frequently if we want our health services to be in good shape. And the Costa Rican approach, so this is the map of Costa Rica. What happened in Costa Rica was, it is one of the healthiest countries in Central America, and then the government of this country decided that every year the budget that I allocate for the army, I should not do that, and instead of focusing on strengthening my army, I should focus on the good health of my citizens. So the army budget or the entire money that was utilized for the good take care of the army was given for the health services. So it decided that this entire money would be spent on the health, on the education and other basic needs of the people. And this approach shows that what is the role of the government when it comes to health, that it is crucial and no person other than the government is responsible for the good health of the people. With this I conclude the chapter saying this, that at times we should go and take the services that the government is providing, because these services are for us and we are paying financially. Do not forget to ask your parents that what are taxes, and just get some information about it, so that when you grow up you realize the importance of the taxes that you are paying and the services which government is responsible to provide you in return. Thank you.